Okay. Thank you for a wonderful overview by Dr. Mitchell. I'm just going to reiterate a couple points here about some of the images we have seen and highlight some points that are relevant to musicians. Some of them have wonderful voice to come in, never expect to see their vocal look like borderline unhealthy. So that would be an interesting point to kind of talk about. Let me see, oops. Here we go. Unfortunately, there's no soundtrack on this one. This is a doctoral student. She's a wonderful singer. Apparently, she's pretty much a good sample to show us that the good vocal folds look like this. But again, even the good singers, you're going to see some mucus coating on the vocal folds, and it's raised no concern because this is an individual self-conscious about health, always have a water bottle with her everywhere, and that's a good habit and something that the teacher need to encourage their students, thinking about water, hydration the whole time. But this is also a singer that because after you sing a lot of performance and rehearsal, throughout the day, there's always going to be getting to the moment, they're going to clear their throat, they sometimes get into coughing, spell, just get rid of those mucus, which should be reminded that really a very bad habit. So this is just a reminder throughout the day. And really talking about knowing and doing is such a different thing. So later on, Ryan is going to bring up some issue about compliance, how we know what information are important for singers and musicians or to know, but how can we make them to do it? That's a very difficult, very challenging issue. Even the teachers know the information, share the information, the student not necessarily want to do it or even register that how important that will be for their vocal health and also their musical career. So this is a good example about rather decent individual, very self-conscious about her vocal health, and she's very keeping in good shape. And I'm just going to show another one. Locate this right here. This is an undergrad student who was gracious enough to come in as a volunteer, have no suspicions or even concern about his vocal health at all. Wonderful voice, no symptoms whatsoever. Perceptually, his voice is great. But by visualizing it, you see that actually the color of the vocal fold is not as pale as the female singers we just saw. And that is something really start to be kind of borderline somewhere that should be a little bit concerned about the health. Something can be better than this because this, you can see the white mucus coating on the vocal fold and the color of the vocal folds is not as transparent or pearly white. That's a color that is more desirable. This raises no concern still because this person has wonderful singing technique, almost can compensate for even just a borderline vocal health issue. But in the long run, we don't know what will be the outcome. If a person continue not to be aware or not to be concerned or changing some sort of a lifestyle, maybe stay away from some spicy food that might trigger the reflux, a lot of health issue. But so this is the individual probably can benefit for some reminder. For the long run, it's going to be very beneficial for this person. And the next one, Dr. Mitchell pointed out this individual does have history of allergy. Actually, in this demographical location, we are pretty much well known to have allergy. Here we go. Allergy. Good timing. So you can see it's not unusual at all. We saw a lot of individuals come in, whether they have symptoms or not. It's rather very common in this area. We see a lot of postnasal drip, thick mucus coating on the vocal fold in the pharyngeal area, which is very, very usual. But this is individual. I'm going to kind of let you see the video clip. It should work. I think it's working now. Here we go. Still no sound. But you realize there's a more obvious redness on the back, and also the vocal fold definitely actually start to look borderline inflamed. It's a redness. This color does not show you well, but when the screen is smaller, it definitely color is more obvious. But still no symptoms. Amazingly, even you can see this is redness already appear on the vocal folds, thickness of the mucus, which it should be concerned, but does not show up in the voice quality because somehow the singing technique, good respiratory support, good technique can still compensate for the problems. So in the short time, they say, oh, it should be okay. It doesn't need treatment. But this person, again, is going to be an individual will benefit from some education, some reminder, some information there, constantly telling them that prepare for a career in the future, it's going to be essential for them to know how to reverse the situation. And this is probably can be easily treated with proper medical intervention to treat reflux, allergy, and then be careful about the hydration issue. Probably this person can have a better shape of vocal fold, even there's still no symptoms yet. So this just kind of highlight there's going to be a variety of musicians there. Going to be some of them will have very, very healthy vocal fold, which I have not encountered one yet, unfortunately, or going to have some people already have organic pathology developed. But we like to do really, especially to treat those, not treat, to take care of a majority of musicians. They are developing something, but it's not symptomatic yet. And those are the individual going to benefit from a lot of information we try to convey in different format. And this will be open for discussion about what will be the best way to send out the information, to share the information with teachers, with students. Another thing I need to highlight would be, we are talking about musicians. We tend to think about singers only, but actually there's a lot of musicians, instrumentalists, playing flute, playing trumpet, playing oboes, and we realize they are probably the populations we tend to overlook in terms of in our profession or in my profession. But they are the ones that actually start to raise some attention on our part and realize they also is the group of people may have health problems related to their instrument playing. After intensive rehearsal, practice, their performance, it's not unusual. They will tell you their muscle is so tight, they feel shortness in their throat, and that make you wonder what happened in there. And I'm just going to bring up a very just extreme case just to make a point. This is the individual playing trumpet, undergrad student brought in by Dr. Chesky. He observed that this student, when he was playing trumpet, his neck is blowing up like a balloon. And at least for myself, it looked just amazingly large neck after this individual played the trumpet. And it just looks so large that you almost worry about it will pop somehow. This individual actually did bring in the concern that he did feel the pain or discomfort sometimes when he tried to play, and he inserted a lot of pressures, and actually he might even experience some problem to get enough pressure to play trumpet. So Dr. Chesky brought him in. We took some video from external, and also scope him to look inside. I didn't see anything unusual from inside. So there's nothing concerned about singing or voice quality. But when I ask more about how about your swallowing? Do you have trouble in swallowing? Because you can imagine when the neck blow up like this, something has happened inside, maybe overinflated esophageal wall, or maybe the pharyngeal wall, or the structures inside. And he did bring up, it's just an interesting point. I think I just kind of asked the right questions. He says some food tend to bother him, especially peanut butter jelly sandwich. After he eat that, you'll stay there for 1 week in the neck. Or anything grainy, like rice, corns, lettuce, anything into small pieces can stay there for a long, long time. This is a 21 or 22 years old individual, very slim individual, tall, very slim neck, but he played the trumpet. His neck probably, try not to exaggerate, it's not double size, but probably can really inflate it and increase about 30 to 40% of the size in the neck. And it's almost in a dangerous point. So we try to get him to do maybe some swallowing study or other type of MRI or CT scan, try to get a better impression or finding about what happened of the internal structures. We have not managed to do that. We need some good Samaritans of physicians willing to do some free service, but we have not found them yet. We'll try. But this is kind of bring to our attention. In addition to singers, we also had to worry about other instrument players. They might also, the population need a lot of the same kind of information to get them to take care of themselves better. And the teachers also had to be aware some of the students are at risk. And eventually some of the students may not really a good candidate to continue pursue the same career because they already have some physical damage on them. The last point I'm going to bring out is this is always a team interdisciplinary type of work together to take care of the same person. From health care provider standpoint or speech pathologist standpoint, we all have our job to do, but also we have to work very closely with especially singing teachers or the music teachers to see that where will be our territory. We don't step on each other's toes, especially we are very concerned about are we doing too much that actually gonna hinder the music teacher's teaching technique. So we try to stay in our own scope of practice to deal with speaking voice or any general education about vocal hygiene or other things that can be beneficial for any populations. But they're going to be open for discussion. I just like to have some input from teachers to say, I think that this is where I would really other healthcare providers can help us doing this, or how much can you do, or how much I don't want you to do. I think that's important that people start to get some pretty good guideline to say what's the fine line that we don't step over, so we don't really actually interfere with each other's work. But the next one, they just kind of introduced Orion's work. They're going to telling us about some of the projects they will be doing, and that hopefully that will highlight some of the compliance issue that kind of educate us about what would be the best way that we can send out this information to share to students and to teachers. Can I get out the PowerPoint or just let it stay? Okay. Oh, I'm a leash.
I wasn't expecting to talk today. Kitty, when she told me to come, said just sit up there and look pretty. I'm very excited because we have a lot of initiatives going on at the University of Pittsburgh, and I want to just tell you a little bit about some of the programs that we've developed. We're very lucky in the Pittsburgh region in that we have great music schools, and we don't step on our voice teachers' toes. And our bias is really that when a patient, particularly in this population, comes to our voice center, that it's probably not their singing that's brought them. It's probably all the other voice use outside, and we really kind of try to quantify amount of time you spend singing, amount of time you spend using your voice other ways. And most of the people that come into the clinic say, I think I'm singing too hard, and you really have to educate them that they probably have multiple voices. They have their singing voice, which they use on stage, which is probably fairly healthy. And then as soon as they walk off stage or out of the rehearsal room, they use a very different vocal configuration that's probably not the most efficient. And so there's really a body of emerging literature that suggests that there are optimal laryngeal configurations, places where your vocal cords should be to get the most amount of vocal output, dB, loudness, for the least amount of impact stress. So the least amount of contact force between the vocal cords, and that's the major pathologic process. And so like Dr. Tietz's work at the National Center for Voice and Speech, he's quantified this. And basically what we found is that the area between the vocal folds, there's not a good picture up. I wonder if I can. The area between the vocal cords here needs to be about 0.6 millimeters apart. And at that point, we can then get a bunch of loud voice and good voice with the least amount of damage to the cords. Obviously, it's very hard to say, okay, I want you to put your vocal processes 0.6 millimeters apart. If we could do that, we'd be out of a job probably, but we have found that there are ways to train this, and we've developed some systematic programs for the pathological population, which involve training this posture on some very basic gestures, and then using some hierarchical structure to then apply it to more complex situations, emotionally charged situations. If they're a teacher, we put them in a lecture situation so that we use the principles of motor learning to develop a new motor plan for laryngeal configuration. We've also just recently started more of a preventative program in teachers, where we have basically used some of the same principles of this voice therapy technique to apply to teachers without current voice problems, in hopes that doing this education and doing this voice work, and we really feel very strongly that just educating people is not enough. You need to get them into a situation where you can teach them postures. You can teach them the difference between good speaking voice and bad speaking voice. We don't have any data, and we actually haven't started the study. We're just putting together the program right now. But it's fairly encouraging, and my role as a PhD student has been looking at the cellular response to exercise. And so I play with cells in a Petri dish, and these cells actually respond very favorably to mechanical stress. So like Dr. Mitchell was talking about COX-2 inhibitors. I can put cells in a Petri dish and work them over, and they actually decrease their COX-2 expression when we look at RNA levels. And so there is this real potent anti-inflammatory restructuring of that delicate mucosa associated with exercise. Of course, it's very hard to carry over what we do in a Petri dish to what we do with a patient sitting in a room or a student sitting in your studio. But there does seem to be a real powerful mechanical signaling pathway that these cells enjoy. They like to be worked. And so that's kind of guiding our practice of voice rest as well. We think that probably their speaking voice is the problem, and we think that it's probably not a great idea to put them on voice rest unless they've just had surgery or they have acute hemorrhage, like Dr. Mitchell said. There are definite instances where that's appropriate. But really, we put people on kind of an exercise program following acute injury with established nodules, and we're having pretty good success. I mean, it makes sense from a biochemical standpoint to have some scientific justification for the exercises that we do. And this is the kind of thing that we would now like to put over into this population, is to have some sort of curriculum that involves not only education and the structures and things like that, but also some voice work program that first-year voice students can sit down with a speech pathologist and kind of learn how their larynx works outside of the singing domain, and let you guys do the singing stuff. We'll take care of everything else. The program is fairly strict in that they do have exercises they have to do every day. They have to be accountable for those exercises. They all get a book. Just like from teaching voice students, you never send them out the door without something written they have to be accountable for before their next lesson. Same principles. People learn better that way. We actually, using this program, just did a study looking at sensory feedback versus imagery. And we find that imagery doesn't work. We need to teach these people how to feel what they're going through and how to feel good voice and bad voice and things like that, instead of using images, which some people get and some people don't. And so we're trying to incorporate kind of founded theories of motor learning to facilitate the acquisition of a new motor plan. So we're very excited, and I'm happy to be able to chit-chat with you, and maybe on the side we can talk about the program and feel free to contact me anytime. So, do we want to leave it up to questions now, or?
Thank you, Ryan. Well, this is a spot where we've done our part up here, and guess who's on the pillar now? You guys. So pretty much we've kind of given a rough idea what all the variety members of the voice panel have come up with as ideas. I encourage you to have more ideas by meeting me at the meeting or sending us emails or what have you. Already had a few suggestions in terms of the problems of eating disorders. I was actually going to leave that to the mental health people, but obviously that is a problem with our people who, for one reason or another, absolutely categorically demand to keeping their weight at a certain level, regardless of their dietary intake. And there is no doubt that stomach contents repeatedly bathing the larynx and the back of the teeth is not good, let alone the other health aspects on it. Also, in terms of the Dizzy Gillespie neck problem, that's a real problem to kind of deal with. As to, you know, should someone along the line have told Dizzy Gillespie to take up the flute instead because he was stretching his neck out? It's a tough issue. Is it something that we should do or urge as teachers or not? And I don't have a good answer on that one. That's going to be a major educational issue to come up with. First of all, with the crew, we have an extremely intelligent and diverse erudite group in through here. First of all, any things that you have as your experiences have shown, pet project, pet areas that need to be addressed that you didn't see on here from a vocal health standpoint? Yay! Firsthand, yes. Actually, if you want to grab the mic here, we'll be glad to. You'll actually be recorded on tape and memorialized for posterity, plus we'll all be able to hear. And I won't have to wear your voice out and give you a nodule by having to strain.
I'm Louise Montello from NYU in New York City. And my question is, or my comment is, in diagnosing people with voice problems, singers, I noticed that you didn't include the psychological questions of, you know, how are you doing emotionally? Because in my experience in working with singers, a lot of them have gone through some kind of a loss or some kind of intense anxiety situation or some other kind of emotionally disturbing incident in their life. And I think that it's really important to spend some time in diagnosing these singers to see if it does have a psychological cause.
Yeah, well, there's no doubt. And I basically totally punted to the mental health team we have here who will be addressing all that, but there's no doubt it is a major aspect on it. I kind of kissed by it briefly on the functional disorder aspects on it, but it's, yeah, we can certainly emphasize it again on this because there's no doubt that if you are mentally not on your game, if you have other issues that are affecting you one way or the other, it'll certainly affect your expression of everything in life, as well as the reception. Your ability to concentrate on what the teacher is telling you is a little bit difficult when you've got this three-piece band going off in your ear with other input going on in there that's distracting you and making you think about other things, and all of a sudden this becomes the most trivial thing in the entire universe and does not affect the global warming and everything else that's going on in your mind. So yeah, it can be a real change, and unfortunately, as we have all experienced, college has just a smidge of stress associated with it. In terms of, you know, this is the rest of my life, I'm going to fail, oh heavens, what will my parents say, and what am I going to do, and my boyfriend hates me, and all of a sudden, and, you know, and she won't return my calls, and you have all that going on in addition to everything else, and all of a sudden, oh, lo and behold, I got a zit. You know, you have these crises that occur that affect everything they do, and I don't mean to trivialize them, but for them, it's very, very important, and you can't communicate, you can't teach, so yeah. Yeah, we can certainly spend some more time on it, but I'm going to hold off on that until I heard what the real experts say, because trust me, I'm in the Bush League when it comes to mental health disorders, and so we have, fortunately, we're Chris was able to assemble a panel who really knows what they're talking about rather than somebody who can blab like me.
We should probably also be more sensitive to that. Also, this may be the first time that a student sees a picture of their chords, and that can be fairly disturbing. Even, looking at normal chords can be fairly disturbing. So that's an issue that we should definitely tread lightly.
Yeah, as a brief aside before you talk about that, I'll mention one little thing. I had to give a presentation using the slides at the Gospel Music Association one time, and I had two little ladies who just about beat the snot out of me with umbrellas because they were sure I was showing pornographic pictures up there. So you have to kind of break gently into the subject sometimes. Yes.
Hello, I'm Jane Middleton. I teach voice at Hardin Simmons in Abilene, Texas. What is your advice or take on the use of guaifenesin, Humabid, Mucinex for singers, and do you advocate that?
Yep.
Yep.
It's basically, again, it's not a panacea. It's not going to squeeze the water out of the sponge if you don't put some water in the sponge to begin with. So I have to get them to still go ahead and drink the water in the first place, otherwise the Mucinex has nothing to work on. It can help. It just basically is a thinning. For those of you who don't know about guaifenesin, is the active ingredient in Robitussin cough syrup. And they make it in a pill form, which you can buy over the counter, or you can still get it on a prescription basis, although your insurance company will insist that it's not available because it costs them more money. But it can help to thin the secretion a little bit. Really a problem is always get older, and the number of glands we have making lubrication kind of start fizzling out and not making the same consistency of stuff. So it can help, but if you don't drink water to begin with, if your sole dietary intake is Jack Daniels, it ain't going to do any good. But it is something that is an adjunct and has very, very few side effects in most people.
Hi, Karen Wickland from Western Michigan University and Roosevelt University. And we've already implemented actually a program that begins from freshman year where all singers are baseline screened with our speech pathology department. Actually, I'm going to be talking about this next week at the National Center for Voice and Speech conference, and it's called also a therapeutic protocol, so that if a singer has an anomaly happen, like vocal cord nodules, what other lesions they might have, they get put on a special protocol, which enables them to be able to finish their course of study so they don't have to take incompletes. So if you want to know more about that, you certainly could contact me. My name's spelled wrong in the program. It's Wicklund, W-I-C-K-L-U-N-D. But I'd be happy to network with anybody who wants to know more about therapeutic protocols that we use.
Great, thank you very much. Anybody else have any programs like that you're using? No, I'm not going to forget you there. I'm just kind of curious. Anybody else have any programs like this right now that they're using? Okay, you're on.
I'm Hildegard Froelich from the University of North Texas. I'm really asking as a choral participant about the practice when one does not feel well and needs to rest the voice, to come to practice but not sing. And I've heard conflicting stories as to whether the vocal cords actually activate as you follow the score or not. I guess some people call it subvocalizing. And I would like to know what one needs to tell music directors and choral directors in this regard.
Ooh, a good one. In essence, if you ask me if there's any good data out there, the answer is no. Do the vocal cords move when you are reading the score? Absolutely. Does your brain imprint the activity so that you actually learn the music that way? Absolutely. It's been shown with PET scans. In fact, it was presented at one of the PAMA conferences where we had keyboard people, and you actually see the area on their brain lighting up as they're thinking the minuet in G, basically. So, the Music Man may not have been too far off. But in terms of does it do damage, well, it depends. If you're dealing with somebody who has laryngitis because the cords are inflamed, no, doesn't do any problem at all. That, and I encourage it. If they have a muscular problem, if they have muscle strain, yes. because like any other muscle, the poor muscle needs to rest at that particular time and recover from its injury. So if they have a muscle strain, then I don't recommend they do that. But if it's just inflamed vocal cords, vocal nodules, a post-operative patient, sure, I have no problem with them not getting behind on all that. But it depends on what the problem is. And unfortunately, sometimes they'll feel kind of similar. And so this is when you need to have somebody look down there and tell them what the problem is. But yeah, they do move. They move also in instrumentalists. There have been some very good studies with brass players and flute players where they've done video laryngeal examinations while they're playing. Trust me, the larynx and the vocal cords are moving a lot. And there's one good study that Dick Stasny did with comparing a professional quality, I think it was trombone player, versus an amateur. You could actually look at the video and say, yep, that guy's a pro, oh, this guy's a doofus. You could see the difference in terms of how the larynx and the vocal cords moved, and it was really, really obvious. So you wouldn't think it would have anything to do with a brass player, but it does. And we're just scratching on the beginning of all this. Next. Yay. Yes, absolutely. There's a friendly crowd here. It's a good house.
Hi, I'm Valerie Trollinger, UNCG, University of North Carolina, Greensboro. My question has to do with dealing with especially very young voices. I'm a trained singer and I've worked with adult voices and have taught adult voices, but my primary research area has been with very, very young voices. And over the years I've run into preschool children, for example, who've had severe aphonia, and one particular instance where this was displayed, and I asked the daycare director if the child had been ill recently, and she said, oh no, she's always sounded that way. And that I've run into more and more kids who are displaying a lot of functional vocal problems. And I was wondering if you could comment on what you're finding with the younger crowd of vocalists.
Okay. Well, until we get precocious people in music schools like they do in the physics departments where you get these 12-year-old PhD graduates, we probably won't see any relationship to this that's applicable to this particular conference here. But on those, yeah, you do see problems, and we do have to scope them when we can, which sometimes can be a bit of a challenge. And it's not easy. It's really not easy because you're trying to do behavioral modification on a child in the age category, as any speech therapist can tell you, can be daunting. Particularly since you're now dealing with the parent-child interface and parent-sibling child interface. And that can be getting into the mental health and psychological aspects of it. Oh, that can be a lot of fun. So if they've got a simple little nodule down there because they scream bloody murder at their buddy, yeah, you can try to work at them to try and get them to do a little bit less. And a lot of them, yeah, the kids get nodules.
It's not an immediate fix, but there is some data suggesting that nodules typically resolve pubescent. So I know it's a long way from the preschool population, but their singing career is not over at 4. Yeah, it's a real hard population, especially vocal pathology is more common in young boys, and then post-puberty, it kind of switches, and more young women tend to present with vocal pathology. But those who acquire pathology before puberty tend to have some level of resolution associated with the growth during puberty. So.
Yes.
Hello, Stephen Austin at the University of North Texas. I'd like to kind of put out on the table an area that I think is really apropos to what we're talking about as far as young, hopeful professionals who are put into an environment at 18 years old where the expectation for simply the amount of vocal use that they experience in the course of a busy week and busy months of a semester as a voice major can be I think one of the most potent sources of problems, regardless of any kind of vocal health issues or even how they use their voice. It's just simply a matter of how much voice use they're expected to put out every week. They sing sometimes in 2 or 3 choirs. They have their voice lessons, church choirs, other jobs, and you mentioned this earlier on. And I just want to call to the attention of the group that there is some work being done by Ingo Tietze at the National Center for Voice and Speech in trying to quantify voice use through the use of a device that their group has developed. They're calling it a dosimeter, which is a little iPack that's been modified. That they're looking at primarily at public school teachers and trying to just simply understand, well, how much voice use does a public school teacher actually experience during the course of a week? I mean, we don't know those numbers. And I mean, we know it must be a lot because that's where we see all the voice problems, or a lot of voice problems. But we also don't know how much voice use the average music major or voice major experiences during the course of a week. And so hopefully, you know, when we consider what kind of information we want to put out there to our voice majors and voice hopefuls, voice professionals and teachers, administrators, choral directors, opera directors. I mean, we need to be aware that that it's not a limitless source of sound, and we have to consider what we expect them to do. And you know, hopefully, you know, OSHA has done us a great service in the business world out there about limiting how much vibration our hands can experience during the course of a work week, because it leads to long-term and permanent damage. And same thing with eardrums and ossicles and all those sorts of things. And the vocal folds are subject to that same sort of limitation. We don't know what that limitation is, but you know, hopefully in a couple of years or so, we'll have some data on what kind of exposure is feasible, and that will turn into some guidelines and recommendations that we can pass then on to folks involved in an educational process like that. So.
Yeah, thank you. Yeah, that certainly sums up some of the things that we've had here, and that's why that slide, that Larson cartoon about the buffalo wondering where we're going, is a little more apropos than we would like sometimes. Unfortunately, there's no really big Jerry Lewis telethon for voice problems, and so we're scratching, trying to get just the funding to do the research that we know needs to be done. And so people like Ingo and some of the other ones are certainly helping us out an awful lot, but there's such a vast lack of objective, hard numerical data on this thing that, quite frankly, we're kind of winging it a little bit. And so hopefully one spin-off that we might get from this meeting and what develops from it might be to be able to have you take back to your departments, and when you've got the young, eager beaver graduate pre-doctoral student who wants to have a project, and go, have I got a field for you? And we can start stealing from other fields like we are already and grabbing them and applying them. But how much voice use do you guys do? I don't know. How much voice use does your student do? Do they even know how much voice use do they use? I mean, these are questions that we need to find out in order to find out, because we can't at a teacher level say, well, you can only sign up for this many voice classes. We don't know. We're not all created equal. You know, some people can do it and some can't. Is it because of what they're doing in their spare time? I don't know. Is it because of the teacher they have? I don't know. If it's because they're an opera versus a pop program? I don't know. Is it because they're female versus male? I don't know. Is it because they're an older student or a younger student? I don't know. You know, we just don't have the data there. We're winging it as best we can and flying by the seat of our pants based on experience, which, as you know, comes from having bad experiences. What do you?
No, I think it would be great to be able to figure out the difference between those, you know, mutants. Those people that can just go on and on and on. Because there are athletic mutants and there are vocal mutants. You know, Lance Armstrong's a mutant. I mean, he can do things that normal people can't. And we have ways of measuring that. We know that his body processes oxygen better, his power to weight ratio. We have these parameters that described his level of mutantness. And we don't have that in the vocalist population. I mean, that would be a real key therapeutic agent if we could say, well, this person can go all day, and here's why. I mean, is it structural? Is it because they have a different motor pattern that they, you know, posture their vocal folds differently? We don't know. And so on top of the dosage issue, it's, you know, it's such a complex organ that you can't put your finger on why there are mutants.
I always thought Ozzy Osbourne was a little strange.
We did have an anonymous question submitted via the audience response system.
Wow.
Oh, well.
And you can get the answer now. How much of what was presented should be presented to every singer who has not yet experienced a problem? 10%, 25%, 50%, 75%, or 100%? And if you missed the opening segment, just use the keypad in front of you that best matches your response. Okay, Bob? 58% say 100%.
That means we've got our work cut out for us.
Although 78% is
Yes.
greater than 75.
Yes.
David Circle from MENC, and I'm also music coordinator in a suburban district in Kansas City. My question has to do with amplification. I have some middle school music teachers, vocal music teachers, who are requesting to use wireless headsets with amplifiers, that they feel like this would save their voice because at the end of the day, as somebody mentioned, they're pooped out. So I wanted your reaction. I philosophically kind of disagreed with that because I'm thinking of it as a disciplinary kind of a thing, and they're having to speak too loudly. But I wondered if there is any, in your experience, have you seen that come up before with teachers using amplification in a regular classroom, not a lecture kind of a situation, but in a regular classroom? And does it work?
Ling, why don't you?
Yeah.
Yeah.
I think there is data suggesting that students perform better as well. It's not just a vocal issue, it's an academic issue. So I'm all for it. I mean,
Yeah, I've seen it. I've had a number of teachers who I've had to write letters to get the Board of Education to improve the funding for their miking system, what have you. This is tough. There's no doubt. This goes back to the equality issue. There's no doubt that some of us can preach forever at a good, heavy vocal range, have no problems, and others can't. Now, does it become a crutch? I suppose it could, but the problem is that hopefully you're dealing with a mature individual who is willing and devoted and wants to do the subject, but for one reason or another can't or won't or is unable to do any conditioning that's effective in order to exercise these muscles long enough to get through the day. Does the amplification work? Yes, it does. Should it be used in every situation? Not necessarily. Should it be available for those people who are noticing fatigue by the end of the day and don't get any better? Absolutely, positively, unequivocally, with no exception. Simply because from a pure pragmatic point, you're going to have a functioning, gifted, talented, trained, expensive teacher who is going to lose less days of productivity. Translate that, technically, you're asking her to not have to go on workman's compensation. How's that for a Pandora's box to open up? Because you're dealing with a work-related accident. So if we can help these people avoid missed days, lost days of productivity, and to be more effective by the end of the day and by the end of the week, sounds pretty good to me. If they can accomplish the same goal just by doing deep breathing exercises and bench presses and warming up before the day, hey, that's fine by me. But not everybody can do it. Not everybody can do it. So I'm not sure it's one of those things where you're going to, there's this crazy advertisement I hear on the radio about these people who say every time you wear eyeglasses, you're making your eyes weaker and you need to do this non-eyeglass formula where you rub your eyeballs and it'll all get better. You all heard that one? Oh, jeez. Okay, well, you know, are you going to turn somebody into a vocal cripple because you use amplification? Hell no.
My name's Elaine Bernstorff. I'm from Wichita State University and in Wichita. And my area is music ed, but also speech pathology. And I've done some research in this area, and just a couple of things I wanted to mention. One is if you got the May Day thing, there's an article, and it says it's not published, but it is in JRME. It was in 1997, the JRME article that's got my name on it, Bernstorff, so you might get some data there. But regarding what you were talking about vocal loudness, when I did this research, I used dosimeters, but at the time they were not the graphing ones, and so I just had data that was just, you know, what were the loudest noises that they were exposed to. Later, I was able to get some dosimeters that actually graphed the day, and it was amazing to me to see that once these people started talking in the morning, you could watch, and their graphs stayed up until their break, dropped for a few minutes, came back up, and then stayed up until lunch. And so they were really using vocal stress, had vocal stress the whole time, or at least that was my assumption, because what happened, we did another study where we looked at the dosimeter readings on the teacher and the dosimeter readings on the students. And my thought was that it was actually going to be louder where the students were than where the teacher was. And what we found was just the opposite. And I haven't been able to really follow up on that, but I think that a lot of this, the loudness that teachers experience is themselves talking at about an 85 dB level. So I think that's something that they really need to be educated on, is how to not become louder and louder during the day. And I was really, really interested in what you were talking about in terms of retraining sensorily rather than just auditory monitoring, because I think that's so important. And then one other thing that you leaned up against, but we've been talking about exercise just in general and also vocal exercise. I've run into several folks who have started, they think they're really going to improve their vocal health by exercising, but they have a tendency sometimes to go into weightlifting programs, and they don't realize that sometimes they are subglottally getting tension and stress as they're doing the weightlifting. And so I think that's one thing that we need to talk about, is that we want you to do exercise and become stronger, but be careful and monitor how you're doing that, because unless they've got a trainer that's watching them or trying to pay attention, they don't often realize they're doing it. Thanks.
Any comments? You're more physically fit than I am.
Hopefully they're not lifting that much weight that they really have to hunker down like that, you know. So, yeah, it would be nice if there was a vocal health while exercising, you know, 2 minutes.
Or Voice of Steel?
Yeah, yeah, Voice of Steel. 1999. Just as an aside, while the next question, there's really been a move away from using the words vocal abuse and misuse just because of the negative connotations associated with those words. And so kind of current thought is to use words like phonotrauma or just talk about injury. You know, you tell somebody they're abusing their voice, there is kind of, it conjures up images that aren't necessarily so positive. So just as my 2 cents.
Yes.
I'm Carol Duffy. I'm an occupational therapist from Port Townsend, Washington. And I am not a speech therapist, but I'm just curious if there's any studies about the effects of laughter on the vocal cords. And secondly, the effect of, there's a popular thing being done now in many communities called overtoning for long periods of time, and also humming for like 20 to 30 minutes at a time. And I'm just wondering if you have any comments about the effect of laughter, overtoning, and humming for long periods of time on the vocal cords.
Laughing, I have no idea. But you notice everybody sounds good when they laugh, so it can't be bad for you. The humming is actually a decent training tool, because we think that if you hum well and have good resonance, that actually puts you into that 0.6 millimeter posture. And so we've actually hypothesized that humming can augment the wound healing process following vocal fold injury. And that's kind of the basic training gesture that we use in our therapeutic programs to train that posture. And then we move on to speech and loud speech and things like that. So humming, yes. What was the last thing? Overtones, I have no idea.
Lynn, any?
Laughter is so.
Yeah.
Okay. laughter is supposed to be the sound of joy, but we do encounter a few individuals do have very explosive laughter. I think it's really harmful in some people, the way they laugh. But how can you tell them just tone it down to 50%? I don't know. It's such an emotional thing. But there could be, in some people, they do have a sort of very loud voice right there when they laugh. Probably something they need to be monitored. But I think most of the people just sounds very, very pleasant. Humming is always one of the voice approaches we kind of introduced to have someone to have a kind of softer voice onset instead of a hard glossal attack. So humming is usually something we kind of put it on our one of our approaches that encourage people to adopt it when they kind of able to start to use a kind of sensory feedback to say this is how you should sound to begin with, and gradually return them to more normal speaking like. Overtone, what's overtone?
I'm not sure what the
What's
overtone is.
overtone? Maybe someone can define that for us.
Diplophobia.
Oh yeah, like those Tibetan monks or whatever, that sing two notes at the same time. Yeah.
Can anybody here do that? I'd love. I've heard recordings. I've never seen anybody live who can. Really?
Ah, okay. Demo time.
This is the Tuvalu culture, the African throat singers.
Yeah.
Yep.
And we're talking about phonating with the false folds as well as the real folds. So you do get two different pitches going at the same time. And the only problem I could personally see with it is if you're getting some hyperfunction going. We do not know unless you could scope and see if there's hyperfunction going. So you'd have to do the nasal scope. And I don't know if any, I don't know of any stroboscopic images of any Tuvalu throat singers. So unless you could see outside function problems, I don't know, I want to see it on the inside first to know if it's wrong, but there are many people in many nations who do it every day. So
I think probably at our music schools here, we're probably not going to have any majors in it right at the moment, but is exceedingly interesting to think about and to apply, because it is another aspect on this thing. So yeah. As far as the sounding, yeah, it is important about the laughter and the sneezing. I said that one singer I had, I mean, he hemorrhaged his cord because of the sneeze. You know, some people sneeze, nothing comes up but mucus. Other people, like my mother-in-law, you could shatter glass 2 houses away because they scream when they sneeze. And it's literally an earth-shattering scream. And so, yeah, some people are very, very violent in terms of how they smash their cords together when they laugh or bark or cough or clear their throats. And that's a problem we need to address on that. It's just, they say trauma. It's just trauma on the cords. And you got, but how do you, it's kind of hard to take somebody who's spent years and years and years of having this habit and give them a break all of a sudden. It's a challenge. Yeah, I saw somebody else around over here someplace who was kind of gophering up in their chair a little bit. If that's it, then we are at exactly at noontime. It is time for everybody to eat, imbibe, and rest your pipes, and to enjoy and meet with everybody and network, and then get back in touch with us. We'll all be here for a while. Okay? Thank you. That's good.